talking about returning to work and COVID-19, what you might see that's a little bit different is I'm not used to putting dates on my title slides. And I was talking to Stacy yesterday, and we decided not only to put a date on, but to put a time on as well. And the reason for that is because Governor Newsom holds daily press briefings. And I was watching his yesterday where he made some announcements. So I did the same presentation for a group of CEOs for for-profit companies yesterday. And I've already had to change some slides, and we're putting 10 a.m. because I can tell you right now, I know some of his announcements he's going to make today at noon, so it's going to change again. So I just want to be clear about that this is a very fluid, as we say, moment and presentation. So just know that. This is my background. That's not what's so important about this slide, but what is, if you look at the bottom, a couple of different things. One is you'll see there a really long link that is to our website. We have some other COVID resources on our websites. Plus, you'll see all of our back emails on this. So a lot of it, you know, when this first started, we started furloughing people, we had just rapid fire emails going out to our client list and just to our mailing list. So you'll see them there. Some of that information probably isn't as useful as this will be today, but some of you may still be thinking about, oh, I might have to furlough some people, things like that. So you could get some useful information there. You can also, from our website, join our mailing list. We don't do anything with your information other than send you emails, usually just the email, like we have a newsletter that goes out each month, and then also we do webinars as well, so you can get on our mailing list for that. Then in the bottom right-hand corner, you'll see there's a link there to actually get the slides. So if you want to, you can just, take a quick picture of that or something. I have it on a couple of other slides as well. If I'd been better prepared, I would drop that into the chat box for you. But Kevin, you might be able to copy it off of what I sent you yesterday.
Yeah, I can put it in the chat box, and I'll make sure to send this to everyone.
That would be great. And then that way you can download the slides. And if for some reason you can't download them right now, just like send one of us an email and we'll get them to you. This is the lovely Stacy who's joined us today. So Stacy is obviously the Director of HR and Administration, and she's been with the organization 10 years now. So super excited to partner with her on this presentation. We've had some conversations over the last week or so that way we can take the information that I'm telling you at a theoretical level and at least give you some examples about how OneOC's doing that right now. Here's our agenda, and again with the slide download link. So there's a whole bunch of different things we're going to go through. Some of you may have to drop out. You'll notice the second to last thing there that says common scenarios. Yesterday when I did this presentation, we got to that a little bit after an hour. So if you do have to drop off, just know you'll see some things in the slides. But if you can't stick around from that, we will address like some of the common types of questions we're getting in the scenarios that come up. What if someone tests positive? What if someone's had exposure to someone tested positive? What if somebody's scared and can't come back to work? And those type of scenarios. So we will be talking about those things as well. I did include at the end of the slides after the Q&A page some bonus slides about the FFCRA. For some of you, you furloughed employees and sent them home prior to April 1st. April 1st was when the FFCRA went into effect. That provided emergency paid sick leave to employees under 6 scenarios, and we will touch on that, and also the opportunity to take expanded family medical leave for even organizations with fewer than 50 employees. And so that's something that you may have to deal with now if somebody says, I can't come back to work because I fall into one of these categories. So we're not going to probably spend time going through those slides, but I wanted you to have those slides from my prior webinar just in case you had questions about those. Okay, as we go, we'll stop along the way and take questions. So just type your questions into the chat box. Just hover your mouse at the bottom and you'll see everything pop up there. And you can just type your question in. Kevin's going to monitor those, and then we'll stop and he'll go ahead and ask those questions, and we'll do the best we can to answer as many as possible. And I can stick around, as long as needed. Okay. All right. So let's start by guidelines for reopening. First of all, there's no national standard for reopening businesses. You guys have all watched the news, Trump and the governors and everybody, no one's on the same page, right, to put it sweetly. There was a bill, HR 6139, that was introduced. 35 senators wrote a letter to OSHA basically saying, hey, we'd like some standardization. We'd like somebody to come out with some guidelines for what needs to be done. It's still sitting in committee. It never moved from the day it was introduced in March. They do have this whitehouse.gov Opening America website. You can go there. I've spent some time on it. Honestly, there's not a lot of concrete information on it. They have it sort of broken down, you know, individuals and businesses and something else, but there's really not a lot of information on it it's just at a really high level. California has this website here, the covid19.ca.gov. California has announced a 4-stage approach to reopening. And right now we're in the current stage, which is a stay-at-home order. This is one of the things that's going to change today. So yesterday, Governor Newsom said that today at noon, he is going to announce guidelines for essentially moving into stage 2, which is allowing some lower risk businesses and public spaces to reopen, okay? Now, it also said that stage 2 would include like non-grocery retail stores. So things like clothing, books, florists, and things like that. He would allow them to have like curbside pickup. So stay tuned. I don't know what he's going to do, but that's what they've been talking about. So moving to stage 2 looks like it's going to happen as early as tomorrow, at least in part. And then it's still going to be months away before higher risk businesses like nail salons and gyms can open. And then probably he said verbally, at least this year, there will be no like concerts or conventions or sporting events, things like that. Time will tell, but that is going to happen today. So stay tuned on that one. So generally, if we just step back and we think about the legal considerations, first and foremost, before you even move to the logistics of it is, you know, ask yourself if your organization falls under an essential critical infrastructure industry. So some do and some don't, right? Some nonprofits do, some don't. It depends on what your nonprofit does. Are you providing social services? Are you providing, you know, like Meals on Wheels would be essential? You know, like what are you doing, you know, as a business, right? So you guys have all done that analysis already before today. Will you be one of the businesses that California is going to allow to open tomorrow? We don't know what those guidelines are. And even if you are, the question is, can you meet the requirements that he's going to put in place? Because we haven't seen those yet. And then also always keep in mind that there's also local and county regulations that are going to differ, right? There may be a higher standard if you're in Los Angeles, or if you have, let's say you're part of an organization that has offices up in Northern California, though there are 4 counties in Northern California that have already extended their stay-at-home order, their shelter-in-place order through the end of May. So even if Newsom tomorrow or today says tomorrow these type of businesses can open, they won't be able to open up in those counties, okay? You always want to comply with the highest standard, the standard that basically imposes the highest burden on you is one way to look at it, but the one that protects the employees at the highest level, right? So somebody asked me about that yesterday. The quick example I can give you is at the national level, minimum wage is like $7.25 or $7.50. We don't even know here in California because it's so much lower, right? Here it's 12 or 13, depending on the size of your business. But if you're in Los Angeles or San Diego, it may be higher. If you're in San Francisco, it's $15 an hour. So can a business or an organization in San Francisco say, hey, I'd like to just pay $7.50 or whatever the federal standard is? And the answer is no. You have to comply with the higher standard of the 15. So hopefully that makes sense to everybody there. Here are some overarching ideas before we get into the details. One thing I would really recommend everybody do is appoint a point person or a team to oversee COVID-19 issues for your organization. I think we lost Stacy for a second. Oh, she just popped back in. I think what Stacy told me is, you know, they have a team that is working together, like their safety team is working on this for OneOC. You know, ask yourself also, is returning to work in person really necessary? Is this, you know, do you need to come back just because you're allowed to come back? I got a phone call from one of my clients that's a financial advisor, and he said, I'm thinking about bringing people back. And I just said, why? Like, is it broken? Is it not working? Are you less productive, less efficient? Are customers, you know, saying, hey, we want to come to the office to meet with you? And he's like, no. And I'm like, then why? Like, just leave everybody at home, right? It's like, for right now, why even risk it? That was just my 2 cents. So give that some thought. You know, if it's necessary to come back, then by all means, you know, come back safely. But just think about that first. Sorry, I'm like scratching my face, like my allergies are out of control today. Another thing, and Stacy will touch on this later, is over communicate, right, with everybody, but especially with your employees. It's so important because employees are really scared right now. They're scared on many levels, right? They're scared about COVID and getting sick. They're scared about family. They're scared about finances. They're scared about everything. So the more you communicate with them, you can reassure them, give them a sense of security and stability. Be human about it, right? Be as flexible as possible with them right now. So if somebody says, like, I don't want to come back to work, I'm scared. Well, if there's a way to let them stay at home and work, then I would say do it. There's no reason to just like force policies on people right now under these circumstances. Like, we're all in this together. We just need to sort of be human about it. Tell them you're scared too if you are. Tell them like you don't know the answer to something if you don't know. That would be my advice to you on that, and just continue to be really flexible with people. Okay, let's talk about safety measures. So we're going to break this down into detail, but we're going to talk about, employee health screening, what you're going to do there, personal protective equipment, all the rest. And I know I'm going fast, but because I don't want you guys to be here all day, because I will take questions on this stuff. So let's start with employee health screening. So the Equal Employment Opportunity Commission has released guidelines for allowing employees to be screened before coming back to work, meaning you can require them to do things like take their temperature prior to showing up, or you could buy thermometers, and then when people come on site, you could test them before allowing them into the building. A lot of my clients are going in this direction. So they're buying one of those sort of gun things, that are, I don't know what you call them, but the ones where they don't go into your mouth, they sort of shoot your forehead right at a distance and get your temperature. So there's no contamination or anything. But you could also buy everybody a thermometer and say, hey, before you come to the office every morning, you need to take your temperature and record it, or you need to notify us what your temperature is when you get to the building, or you could do a whole bunch of different things like that. But the CDC guideline is if the temperature is 100.4 or higher, that they should not come on site to work. Okay, so if they're at 99.9, they're good. 100.1, they're good. But if they're hitting 100.4 or higher, then they should not work on site. You also can screen them for respiratory symptoms. You guys can all go look at the symptoms on CDC's website. They did get updated like a week or so ago to add some new ones, but look at the respiratory systems like cough and shortness of breath. You could ask people to answer questions about that. You could give them a form to fill out when they show up at work. You could record their answers. You can do a lot of different things with that. Anything that you document, though, must be kept in a separate confidential medical file for that person. So do not have like one big sign-in sheet where everybody comes in and signs their name and puts their temperature or something like that, right? You want to protect their personal health information, and you want to keep it in a confidential medical file. You could have people email you. You can do a whole bunch of different things, but just remember you need to keep that confidential and separate from everything else. Also remember that if there's like a line of people coming in, as soon as they're in line waiting to be screened, that is compensable time. So that starts the clock for their workday. Okay. The Department of Fair Employment and Housing, which is the EEOC's state counterpart, they just want to remind everybody, it's like they're falling in line with the EEOC on this one to a certain extent, but in California, employers cannot ask for a diagnosis. So you can inquire about symptoms, but you cannot say like, hey, did you test positive for COVID? You can't ask that question. And yet, here's the rub. In order for you to get tax credits for payments made to somebody, they have to sort of tell you, and they have to have a doctor's note saying, hey, this person's, COVID positive, and then you would have to pay them sick pay. You would need documentation in order to get the tax credits and to know that they qualify, and yet you're not allowed to ask for a diagnosis. So it's a little bit crazy making right now. Just, err on the side of caution, and whatever you do, just make sure you're protecting everybody's personal information when it comes to their health records, okay? All right, so health return to work guidelines. So let's say somebody has symptoms, they test positive, whatever, there's different rules for this, but generally speaking, here are the return to work guidelines the CDC has published. The person has to have no fever for at least 3 days, and that's without taking medication, okay, to reduce that fever. So if they're taking Tylenol or aspirin or something and their fever's down, that doesn't count, right? They've had no medication that would reduce their fever for 3 days, and their respiratory symptoms like cough and shortness of breath have improved for at least 3 days. They don't say that they have to go away entirely, but they have to be like improving over 3 days. And it has to be at least 10 days since the symptoms began. That said 7, and then they updated that on May 3rd, okay, to 10 days have passed since the symptoms began. All right, so those are the rules for allowing someone to return to work. Okay, so somebody comes back to work, you want to think about what safety measures are you putting in place with regard to personal protective equipment. Now, as of right now, there's no necessarily like standard or requirement. In certain counties and certain cities, we have requirements to wear masks if we're out in public, for example, things like that. Um, Again, Newsom will tell us what's required, but right now you need to make those decisions for internally at your organization to figure out what's going to be required. Are you going to have employees, required to wear masks under certain situations or in certain positions, or depending on, what they're doing at the time? Like I've got a property management company that's bringing people back into the office 3 or 4 at a time, just seeing how it goes, right? And they're going to have a rule that if somebody comes to your desk to talk to you, they have to stay 6 feet away, but both parties have to put masks on. But if you're just working at your desk by yourself, you don't have to wear one, right? I was telling Stacy that the doggy daycare where my dog goes, now I reopen on Monday, and so I took my dog there this morning as an example, but when I go in to drop him off, I have to put a mask on, right? And they have it posted everywhere, so everyone knows the rules, okay? So think about masks, gloves, face shields, uniforms, or other sort of clothing as, protection, hand sanitizer, and make sure you can purchase it before they come back. It's not going to help you if you say, yeah, everybody has to wear, masks and use hand sanitizer 5 times a day if you can't get them, right? So think about that as well. All right, detailed cleaning procedures. The CDC has really specific guidelines for cleaning and disinfecting. They sort of break it down into routine cleaning, like what you should be doing on a daily basis, and then what you should be doing more frequently for high touch surfaces, doorknobs, computers, phones, things like that. There's also, you can put together a cleaning and disinfecting schedule, and also clearly you're gonna need some more detailed cleaning procedures in the event somebody tests positive in your office. Purchase supplies in advance, make sure you have those as well. Train your employees on it, and then also figure out who's going to be responsible for cleaning. Is it a third-party janitorial crew? What rules are you going to have for them? Is it people in the office? Are you going to share it? One person's designated, all of those different things. And the link on that slide is to the CDC website on that. Okay, physical distancing. We're all used to this now, right? Redesigning workspaces. See if you can do it. Not every business is going to be able to move people around to maintain 6-foot spaces. You can also think, though, about putting up plexiglass or other barriers. Like I was telling the group yesterday, I went into U-Haul a couple weeks ago to rent a truck, and they have plexiglass up. They've moved like the credit card machine 6 feet away, put it on one of their boxes. And so I was standing that far away. We had masks on. So think about those type of other physical barriers you can create, especially if you're, customer facing or client facing, and people are going to be coming into the office. Another thing that's been really popular for a lot of organizations is creating one-way traffic patterns. So as people move through the office, having them go in one direction, if you're going to go to that corner, you're going to be on this side of the room versus this side of the room. I sort of laughed yesterday, and I think about it like Nordstrom. If you've been in Nordstrom before, they're very conscious about how they design their escalator. So you have to walk around the entire floor to go back up the other side, right, to get to the next floor, because they want you to see all their merchandise. So think about those one-way traffic patterns instead of like, oh, they can just turn around and go this direction, and that will limit the face-to-face contact people have. You want to limit the number of people in shared spaces at giving time, and that could be conference rooms, restrooms, lunchrooms. It could be even individual offices, right? Think about how many people would fit in here in a safe distance. Another one of my clients is taking out from their conference room, they're actually physically removing chairs, and they're marking on the floor where the remaining chairs can be. And they've measured it out so they know how everybody's going to maintain their distance. Restrooms, if it's a single restroom stall, then it's a non-issue, right? But what if it's one where you have 10 stalls in it? Like, are you going to limit the number of people that can go in at any given time? So think about that, and you want to create posters and put them up so everybody knows what those rules are. Lunchrooms are going to be interesting. Another one of my clients is, they said only one person at any table in the lunchroom, and they have a pretty small lunchroom. So you have to think about how you're going to limit that, but also, you're going to have to play by wage and hour rules in terms of scheduling lunches. And so that's going to be an issue as well. So you can adjust schedules for people. Some of my clients are have been doing this group A, group B. So they'll have half of the team in the office week 1, and then they work from home week 2, and they, switch off that way. You can stagger the shifts if that's going to help you with lunch in particular. So, people could start at 7, 7:15, 7:30, 7:45, like that. You could schedule it however you need to throughout the day, and that way you can stagger lunches and breaks as well. And then that way everybody can eat in the lunchroom or whatever, however they do it. People, you should really discourage people from eating at their desks, because that creates another wage and hour issue. Are they fully relieved of duty? Things like that, because people will walk up and talk to them and not know that they're at lunch necessarily. So you have to think through those wage and hour issues. The other thing to remember is there's nothing that says you can't continue to use all of the online tools to meet and to talk with people in the office. You don't necessarily have to go into, a conference room or something like that. You can still use GoToWebinar or Zoom or Google Hangouts or whatever you're using. We have clients that use Band and Slack and other types, WhatsApp, other ways of communicating with each other. Now, there's nothing that says you can't continue to do that, or any of the Microsoft products or Apple products out there, to just continue to allow people to stay in their space and not have to go and be face-to-face with other people.
Hey, Linda.
Yeah.
We had a couple questions going back to, in terms
Sure.
of masks and gloves and requirements. Okay. A question that came in earlier on was, if the organization doesn't have access to the materials or gloves or cleaning things, I'm assuming maybe because of financial resources, is you said something along like there's certain CDC requirements, and then there's certain requirements that the organization can set individually.
Yeah.
Is it the cleaning requirements or CDC, and then the masks and all those things are decided based off the organization's requirements?
Well, to a certain extent, yes. Okay. So, the CDC is there's no national standard, right? So the CDC can just recommend things. So they can tell you like, hey, we think that you should clean these type of surfaces daily or weekly or every couple of hours. They can make those different types of recommendations. And that was my first slide. There's no national standard, right? So there's no right now rule governing that says you have to do this. Now, again, stay tuned. At noon today, we don't know what's going to be said, right? So there could be coming out with some guidelines for that later. I don't know. In terms of masks, that could be city or county specific, right? So like in Irvine, we have a requirement, I think, to wear a mask if we go outside or something like that, right? Or if you go into like a restaurant to pick up food or anything like that. It could be set city, county, state, federally, right? So you have to look at all of those different things. We're also going to talk in a couple of slides, we're going to talk about an OSHA standard. So I will comment on that again at that point. Okay. And then in terms of like the equipment, if it's required by you or by law for someone to have safety equipment, the company has to provide that. So when I listened to that question, Kevin, my thought wasn't financial. My thought was they may not be able to get it right now.
Right. Limited supply.
So you need to think that through. Like, don't bring everybody back in the office and not have the ability to clean it, right? Or sanitize it. So you can have third parties come in and do that also. But if your standard is going to be, and Stacey can speak to what they're going to do, but if the standard is going to be, hey, we're going to sanitize these areas like every 2 hours, and you don't have supplies to do it, it's a moot point, right? Then I would say, why bring people back right now? If you think, oh, we don't really have that many shared areas, people are just going to stay in their own little, place or something like that, then maybe it's a non-issue. Every business is going to be different for sure.
And those requirements, if you make them for employees, saying all employees need to, the thermometer process and wear a mask, can you require that of your clients or other people that might be coming to your office space for meetings? Or one of the questions was like they run an after school care program. Can they request that parents have to wear face masks? And if they don't have the money to buy one, are they obligated to provide them with the mask?
For a third party, you wouldn't be obligated to provide it, and you could certainly have that standard. We're going to talk about third parties in a second. For your employees, if they don't have it, you would be required to provide it to them if that's your standard. Okay. All right. So the other thing is eliminate shared items or clean them frequently. For example, think this through. Do you really want a shared coffee pot or certain things in the lunchroom that maybe you haven't thought about? I would definitely either not bring food in at all right now, or if you're going to allow people to bring food in, make sure it's like single, like single serving type packaging, right? So like a corner bakery, for example, you can order lunches. They could bring a platter of food in, people can make their own sandwich, or you can have them pre-make sandwiches and it comes with a cookie and an apple and whatever in a little box. That's the route you want to go right now for sure, where people aren't doing the buffet style or anything like that. You also think through like telephone handsets. If you've got first shift and a second shift and they share the same computer, the same phone or something like that, you're going to want to make sure that you're getting a second phone for people, or that there's a requirement and a process for wiping down the handsets and everything, and other tools that are shared by other employees or working different shifts. Conference room keyboard and mouse. A lot of us have computers set up in conference rooms hooked to the TV, things like that. There's a remote for the TV. All of those are going to be shared items. So you want to make sure that you have a process in place for making sure that you can decontaminate those. Copiers, doorknobs. Stacey and I were talking about, she said that one of her clients is thinking about removing doorknobs from all the doors so they can just be pushed open. So think about those things as well as you move forward. Restricting business travel. I don't know if any of you have a need to have any of your employees travel from home to work, but you want to limit travel to essential. You're going to have to decide what essential is for your particular business. You're going to want to establish procedures for when they're traveling, but also for when they return, right? Are you going to have them self-quarantine? Do they require them to work from home for a period of time after they come back? So think through those issues as well, or just say there's no travel right now, whatever your organization needs to do. And then now third parties. So think about the different groups of people are going to come on site. You're going to have vendors, clients, temps. For all of them, what's your policy going to be? If you're testing employees before they can come into the office, but then you allow all these other third parties to come in without testing them, I don't know if that makes a lot of sense. So you might want to have that policy to say, hey, if you're going to be anywhere other than the lobby or something like that, you need to have your temperature taken before you can come in. That would be, to me, a smart policy to have. Think about if you're going to provide the PPE for them, or if you're going to say, hey, you can come on board, like my doggy daycare program, I have to have a mask when I go on. They're not providing masks, but I have to have it with me or I can't go into the building. That's a perfectly legitimate policy to have. So you can set something like that up. I would be very careful about doing too much more than taking somebody's temperature, only because, again, you don't want to be viewed as a medical provider, right? You don't want to cross a line there about saying, well, tell me what symptoms have you been having, to anybody that comes into your building. So I would sort of be wary about that, but definitely the temperature taking is perfectly fine. Are you going to restrict traffic? Are there only going to be certain places they can go? Like they can come in the lobby, they can't go further, or they can come in the lobby and go to the closest conference room, but that's it. Things like that. So just think about that. Maybe institute a policy of no handshaking, right? Most people right now are, doing other things or just staying back completely. And then also think about just silly things like maybe you have a requirement that when people come into the building, they have to log in, right? So you have a bunch of pens sitting there on the desk and then people sign, put it back in the little pen holder. That's probably not a smart move right now, right? Say, hey, that pen's yours, or, do something else, have a receptionist that actually does the log for them, things like that, so you're not sharing resources. And then also on the deliveries, the best practice here is to provide contactless pickup and delivery of products. So if things are shipped to your office, they can be left wherever is appropriate. If you're delivering products to somebody, make sure it's contactless. I know, like when I've ordered food from restaurants, my local restaurants that I want to make sure stay in business, I go and it's like, they come, they put it in the backseat of my car and, we wave to each other basically, and that's it. Or, if it's delivered to my house, they leave it on the front porch. So think through those type of things. And then the best practice would be to designate like one location for accepting deliveries, so you can clean that area frequently, because you'll have third parties coming in and out. So that could be a warehouse or some back door like that if you're used to getting deliveries, and it could be the reception area. It's all good. Again, there's no rule for this. It's really what's going to work best for your organization. So I'm going to stop right there, see if there's any more questions. Let Stacey weigh in on anything. But you have to unmute yourself, Stacey. Stacey, unmute yourself. There you go.
Yeah, I'm unmuted.
Okay.
So yeah. We're going to take other questions first.
Yeah, I don't know if we lost Kevin or not.
I'm here. No.
Okay, we just lost your video, I guess. There you go.
We go.
Are there any other questions that popped up?
Yes, we had one person, I don't know if I fully understand this question, but after travel, is self-quarantine time paid sick time?
That's a good question. I don't, the organization has the right to send people home to self-quarantine without paying them. So I guess you could have that policy if you wanted to. I mean, I'm trying to answer the question legally versus what I think you should do, because
Right.
because it's going to get old. You're going to lose people if they have to travel for their business and then they come back and you say, okay, but I'm not going to pay you for the next 2 weeks as a result. I think personally, I would have a different policy. I might say that they might have to wear a mask in the office for a period of time afterwards. Or maybe they stay home for 72 hours to see if any symptoms develop and then they come in and wear a mask. Because you always have to also think about not just what's right for that employee, but right for everybody else. And part of what's right for everybody else is reducing the fear factor, right? So we've had this come up a lot where employees come forward because of something going on in another employee's world, and they feel like it's going to impact them, right? So I would probably say you don't have to legally pay them if you're going to tell them they have to self-quarantine. But I would just think about that if that's the right way to treat the employees. And then
Yeah.
also, I think there's a big difference. If I go on a trip, right, and I choose to take vacation time and I travel personally, I think you could treat me differently than if I had to travel on business. That's just my 2 cents, though.
Meaning if you traveled on vacation, they could require you to self-quarantine?
That could be a rule up front. It's like, look, I'll approve your vacation, right? If you want to go travel, especially if they're going to travel internationally, which is virtually impossible to do right now. But let's just say, they have family in Mexico and they're going to go there for a week or something like that, right? And then they come back. My rule for that might be different from my rule that somebody's traveling on business, right?
Right.
So I might say like, look, I'll approve your vacation time, but just know if you come back, you're going to have to either work from home or self-quarantine. If they can't work from home because the organization doesn't have the business for them to work from home, then maybe you just tell them you need to factor that in because I'm not going to pay you for that period of time.
Mm-hmm. Got it.
So.
Great. We had a couple more questions come in. If you run programs for kids, can you require the kids to wear a mask while being at the program?
Yeah, you can require, I don't know, anything that restricts you from requiring masks on kids.
Yep.
There is the recommendation that kids under 2 not wear masks, but.
Okay, that's good to know.
Yeah.
And then the last question was, this is probably for you, Linda, or for Stacy as well. If we need help with putting these policies and practices together and train our staff, is there a consultant who we can ask to help us? You have 2 on the call.
Yeah, yeah, absolutely. So yeah, and we discount our rates for nonprofits as well. But if there are free resources or things will cost you less by going through OneOC, start there for sure. But yes, of course, this is what we do for our clients all day long. So
Awesome, thank you.
Stacey,
Yeah.
Stacey, did you want to weigh in on any of the things we've talked about so
Well,
far?
here at OneOC, we are, and we're going to talk about this a little later about just the 6 factors that we're looking at. 6 essential factors, basically, to say that we're prepared to bring our workforce back. But right now, just want to say ditto to what you said, Linda, about preparing the facility. So I've been here at the office many days throughout this time, and as I walk around, I just see things that we have to put in place. For example, I went to get ice yesterday out of the kitchen, and we share the spatula or what have you,
Right.
that we use to get ice out the bucket. So that's going to have to change. But it's those little things that you really want to pay attention to. You said silly things, Linda, but like the pen or what have you that everyone shares, and the mouse and the conference room. So right now we're preparing our facility. We're getting our facility together, and we'll move to the other stages from there.
That's great, because and I don't mean silly as an unimportant. It's just like it's silly to me because we do it so unconsciously throughout the day.
Right.
And that's the problem, is you have to stop and be conscious about it. Like, oh my gosh, like touching my face. Like, I follow Conan O'Brien on Twitter, right? He has these like really funny, just like one sentence tweets. And one day he just said his new personal best for not touching his face at like 37 seconds. And I was like, I replied him and I said, you beat me by 36 seconds. It's like, I just feel like I touch my face all day long, right? And everyone's like, don't touch your face. And I'm like, I can't not touch my face, you know? So it's being conscious about that. And just trying to interrupt that pattern and walking around the office and just looking and thinking and stopping. And again, this is where having like a committee or a team do this is really beneficial, because if you put the pressure on yourself to think all of this stuff through, you're going to miss a ton of stuff, right? Because you're in your own paradigm. So it's like, Stacy, I know you've got a committee, I think you said, that you put
Yes,
together.
we have a safety committee. We have a safety committee that's taken a helm of this.
Right. So that's awesome. And then you can all sort of look at it through your own eyes and watch each other and watch, you know, just think through your day and, you know, keep track of like things like a spatula for ice, right? Like I would never have thought about that. Or, you know, we were talking before, it's like the pens at the front desk. It's like, oh my gosh, like, okay, that's something we just don't even think about. And this is just a brand new world. So it's going to take some getting used to. So anything else, or should we move on right now, Kevin?
Probably good to go ahead and move on.
Okay, awesome. Keep those questions coming. They're good questions. Okay. All right. So OSHA and workers' comp. This is going to change everybody's world, because this was the change from yesterday when Newsom talked. So a couple things to know on this slide. One is that there is this general duty clause that appears in this OSHA Act of 1970, right? And it requires employers to furnish each worker, you can read this, employment and a place of employment which are free from recognized hazards that are causing or likely to cause death or serious physical harm. Common wisdom is that COVID-19 would definitely be covered by that, which leads to some additional requirements in terms of putting together like a COVID response plan we're going to talk about in a second. There's also OSHA regulations at 29 CFR 1904 that just break down a whole bunch of different safety related things. I would encourage you to go look at that CFR section. You can just literally Google that and then just pull it up and think through all the different things. So it talks about exposure to hazards, it talks about recording injuries and illnesses, it talks about a whole bunch of different things. Now, we've been getting this question a lot over the last month: is COVID-19 a workers' comp illness? As of yesterday, the answer is yes, okay? So what happened yesterday at Newsom's conference is, up until now, they have said it was they call it a rebuttable presumption, okay? So they're gonna presume that up until yesterday, anyone that was a first responder or working in healthcare who contracted COVID-19 did so at work, and therefore it made it a workers' comp claim. Yesterday, they expanded that by executive order for any essential worker. And now why we use those words is because it doesn't apply if they're working from home, right? So if you have everybody working from home and somebody gets COVID, it's not work related, even though they're working, right? It's only for those essential workers. So it means like grocery, you know, people working at the grocery store, your Instacart delivery person, your, you know, anybody that's continued to work, it is now going to be presumed that it's a workers' comp claim. This is going to radically change things for people. So wait for your carrier to tell you, or reach out to them and say, hey, how do we handle this, right? Because presumably you're going to either have to argue that they contracted it someplace else if you have specific knowledge about how somebody contracted it. Say, for example, you know that they live with a family member who contracted it. You could try to argue that they contracted it there as opposed to at work, something like that. But if you bring people back to work and one person at the office contracts it and someone else does as well, you can bet that you are gonna end up with a workers' comp claim. I'll just say it that way. So, you know, stay tuned on that, but that was the guidance that we got yesterday. Okay, let's talk about recall procedures. So you've thought of this all, you have all your policies and everything in place, you're ready to bring people back. How do you decide who to bring back? So the things to consider, first and foremost, it has to be non-discriminatory decision making. You can't obviously decide, I'm going to bring all the white people back, or all of the women back, or all of the whoever back, right? Fill in your blank with whatever protected category you want. The issue I would just point out is I don't think anybody ever has the intent to discriminate. They don't look at it that way, but they also don't ever look in the rearview mirror to go, how did this look, was there any adverse selection that I didn't intend? So just make your, do your decision making, make your list of who you're going to bring back if it's not going to be everybody, but then turn around and look in the rearview mirror and say, how would this look to someone that wasn't part of this process? Does it look like we unintentionally discriminated against a group of people? And just take that approach. Now, what we've been suggesting to people, to our clients who aren't bringing everyone back, is to just do a quick rating. Have your managers rate all of their employees on whatever scale you choose. Okay, again, there's no guidance on this. So for example, we have a brewery as a client. We furloughed all of their hourly employees. They got their PPP loan. They're starting to bring people back. They don't have room for everybody right now. So what they decided to rate on was job knowledge, attitude, and attendance, I think. And they just came up, those were the 3 things they thought were most important. They had all of the managers rate their employees on each of those 3 things on a scale of 1 to 10, so a possible 30 points. And then it's easy, like if they need 5 chefs, for example, and they have 10, they go, okay, who are the top 5? And they start with them, okay? And then that way they bring them back. So something like that would be great. If you already have, have in the past done like performance appraisals, you have something you can point to, that could be done as well, but just be consistent in it. Okay, that's my advice on that. The second point here is there's another opportunity for you if you're not familiar with this. There is the WorkShare program. Really quickly, and we can take this offline if anybody wants more information, but if you go to this link on the EDD website, WorkShare is a program that allows the employee to collect wages and workers' comp on top of it if they don't get their full usual work. So let's use an easy example. Let's say you have employees, your employee's making $1,000 a week, right? They're going to max out their unemployment benefit at $450. So if they're not working at all, they're going to collect $450 a week. This is like high level rough, okay? Let's say though, you say, I'm going to bring you back half time. Well, half time they'd be making $500, which is more than their $450 benefit, so they wouldn't get any unemployment benefit. But under WorkShare, they would keep their $500, and then on top of that, they would be entitled to 50%, because that was what the reduction in work was, 50% of what would have been their weekly benefit. So they would get the $500 in wages plus another $225, or half their benefit on top of it. It makes a big difference. So that's something to consider, whether, instead of only bringing 5 people back out of the 10, maybe you bring all 10 back, but at a reduced level. So that program right now is taking between 2 and 3 weeks to get approved by the state if you get your application in. There's a little bit of administrative burden for whoever does payroll because they have to complete a form, but it's a huge benefit to the employee. And what we also don't know, we're waiting to find out, is we believe that they could still be entitled to the $600 on top of their other unemployment insurance, the one that's coming from the Fed. So that's just something to think about. You also want to think about creating a plan for high-risk employees. And high risk, I mean employees that are over the age of 65, or employees that have a compromised immune system or some other underlying medical condition that makes it more risky for them to be around other people. Think about, can you allow them to continue to work from home? Can you put them on a different schedule? Can you limit their, contact with other employees if they come on site? So just be prepared to think about that as well for those people to support them. Now, we also have some scenarios toward the end about how to handle employees who are unable or unwilling to return to work. So there's a couple of things that come up. You're going to have some employees who are going to say, thanks for calling me back, but I'm doing just fine, because they're actually making more money at home not working right now than they would be if they come back to work. We've had this happen already, again, with our brewery client, because we've brought them back, or we've said we're ready to bring them back, and they're getting their unemployment plus they're getting $600. Well, for minimum wage employees, they're making more money staying at home right now. Anybody, I don't know what the cutoff is, but if you're making 15, 16 bucks an hour, you're making more money staying at home, right? So you're going to face some reluctance for people to come back to work right now. Now, some of you have people working from home, so this is a non-issue, but if you have furloughed people and they're not working, be prepared, you might have some additional issues you have to face there. So I don't know what the procedure is, I haven't been able to find it, but what EDD wants to know is, hey, did you make a job offer to someone that they refused? Because that will mean that they are not eligible to collect unemployment. So that is the leverage you have. If you reach out to an employee and they go, yeah, I don't want to come back to work right now, just say, okay, well, we need to notify EDD that you refused work. right? And then, and in theory, that means they're not eligible for collecting unemployment. So that might be a little leverage to get them to come back if they're balking at that. You want to keep a record of the offer to return to work and the refusal. So you could make the offers in writing if you want to. You could follow up in an email. You could do a lot of different things. But you could consider that to be a quit and go ahead and terminate the employee. Now, you're also going to have employees that are unable to return to work, and they may fall under one of these 6 reasons. So again, these slides are in greater detail at the back of the slide deck. So I just wanted to throw this one in because remember, again, if you furloughed employees prior to April 1st, you didn't have to deal with this. This law, the FFCRA, went into effect April 1st. So now you might have employees, because this isn't effective at the end of the year, you might have employees that say, hey, I can't come back to work because, you know, I'm in a high risk category, which would fall under number 1, or, you know, I'm sick with COVID, or I'm sick with something else, right? It could be unrelated, but they would be eligible for the emergency paid sick leave for 80 hours under this. Or I'm, you know, my mother tested positive and she's sick and I need to stay with her and take care of her. Or, you know, my kid's home from school or childcare and I can't come back to work because of that, right? So there's all these things that could happen, and just remember that the FFCRA does provide 80 hours of sick pay for people if it triggers one of these 6 things. And if it triggers number 5, where they have childcare issues, then they may be eligible for an expanded family medical leave or some other type of leave of absence. So think about that as well.
Hey, Linda.
Yeah.
Can we go back to that slide real quick?
We can.
So great question here. I knew we were kind of getting to there. Vitana asked, you know, if the employee is stating that they don't feel comfortable coming back and they don't fit into one of those 6 categories, what's the response of HR in terms of disciplinary and all that stuff?
Yeah, so we actually have one of those scenarios later on in the slides, but I'll just quickly touch on it. So the employee can't just refuse to come back to work because of a generalized fear. So I do have a slide where we can talk a little bit more detail, because it could be something specific, it could be more general. If you have to jump off before we get to that slide, then just reach out to me and we can talk about it later to whoever asked that question, but we're going to address that in a little bit.
Okay, and then one more question before we go to the next slide.
Yeah.
What are the risks if employees do not follow the safety protocols even after they sign a safety agreement? Or how would you address that?
Yeah, I mean, I think that's a disciplinary issue. It's a complete management issue, right? You need to make sure that everybody's following all of the procedures you put in place. You want to train them, you want to document the training, everything like that. You could fire the person. You're going to have a lot of help from a peer pressure standpoint, though, I will tell you that, right?
Yeah.
So you have a lot of help just based on the types of questions and calls we get from clients all day long. There's a lot of fear on a lot of employees' parts. I mean, you do have people that are, you know, very cavalier about this, like, come on, let's all like open up the state and go back and stuff. And then you have the other people who are afraid of everything, right? So you have to be able to sort of adjust and deal with that whole range of issues. But if they have if people are not following the procedures, it's like any other safety procedure. You have a responsibility to the rest of your team to enforce those policies.
Okay. And sorry, one more question. They're all coming through. In terms of these 6, you know, unable to return to work requirements, is there a statewide requirement or is it organization based or local based in terms of like proof of illness, doctor's note, or I'm unable to take my kid to daycare because of X, Y, or Z?
Yeah, great question. So yeah, so there are definitely rules. This comes from the Department of Labor, actually, because this is a federal program. You can Google well, you can probably go to my website and find some information as well. But the Department of Labor released a lot of Q&A. They're up to, I don't know, like 70 questions or something. And so some of the questions is about the documentation. If you are going to pay people under EPSL and seek tax credit reimbursement, you are required to have proof, actually. And this is what I was saying earlier. It's sort of interesting because in California, again, we're not allowed to ask for a diagnosis. But in order for someone to qualify for EPSL, they have to prove that they're either sick from coronavirus or that somebody else is. So you're like, okay, we're a little bit stuck. We're going to play by federal rules on this as far as I'm personally concerned. Again, you want to do everything you can to, you know, protect the employees, and we're going to have a scenario later about what happens if somebody tests positive and how you handle that. But yes, you can require documentation. So on number 1, for example, this would probably just apply to anybody that has some sort of autoimmune disease or some underlying medical condition where their doctor thinks they shouldn't come to work, or they're over the age of 65. Over the age of 65, easy to prove, right? Driver's license, something like that. Number 2, though, if they do have an underlying medical condition, then they should go to their doctor and get the doctor to say, hey, don't come to work, which falls under number 2 anyway. So I think I would just roll with that. If the employee is experiencing symptoms of coronavirus, and they need to be seeking a medical diagnosis in order to qualify for this. The other thing on number 3 is a little bit weird because you only have to pay them for the time that they're seeking a medical diagnosis. So if they're just staying home on their own because they have symptoms, they're not qualified for this under the law. You can choose to pay them, but they're not qualified under this. They have to be seeking a medical diagnosis. So the time spent making the appointment, traveling to the appointment, at the appointment, things like that is paid for, but the rest of the time sitting at home technically isn't. It's a weird one if you ask me. The 4th one is caring for an individual who's under quarantine or isolation order, who has been advised to self-quarantine. So this is like you're caring for another person. You would, sort of like regular FMLA, you would want something from a doctor saying that this person, needs care, basically. And there's a presumption that your employee would be expected to care for that person. So it's not like, hey, a friend of a friend, I need to stay home with them, right? It's not like that. A roommate, a family member, it has to be somebody like that. And then the child care, yes, you could request documentation for a couple things. You could request documentation that the school or the child care is closed, right, due to coronavirus. And then you can also request some sort of documentation that this is the only person that can care for them. So if there's another family member that can care for the kid, you don't have to authorize this. Okay, so a couple different levels there. Does that make sense, Kevin?
Yep, definitely.
Okay, anything else, or should I move on?
We had one more question. If a part-time employee loses their other part-time job, can they apply for unemployment work sharing program since they lost their other part-time job?
So they can apply for unemployment. They potentially could get it. I'm not an expert in how they do all of their math calculations, so I don't know if someone has 2 part-time jobs. I would definitely tell them to go apply and see what happens. The employee does not apply under work-share. Work-share is where the employer applies. So if you're going to bring people back at a reduced level, right, and there's rules around what percentage and stuff like that, but if you're going to bring 10 people back at 30 hours a week, that's when you use work-share. But the employee on their own cannot apply for work-share, if that makes sense. Okay. All right. Okay, moving on to the next topic. And again, keep asking your questions because I will stick around and answer them as long as I need to. And Stacy is always there for you as well. So new hire paperwork. If the employee was, again, if the employee's been working from home, this is a non-issue, right? But if the employee was furloughed, then generally new hire paperwork isn't required. It was like they're on a little leave of absence. Just keep in mind one thing. You have the requirement for non-exempt employees to provide them with a wage theft notice. It's a section 2810.5 form of the labor code. This is something you have to give to all new hires all non-exempt new hires when you hire them, right? You've all seen it, hopefully, is a document that says like their name and their hire date and how much you're going to pay them and their sick pay benefits and their workers' comp information and all sorts of stuff. Well, if you bring someone back into their same job, it's a non-issue. But like my brewery client, for example, they're bringing people back, but they may have what they call beer tenders, think bartender, that they're not serving in the restaurant, right? So they're bringing them back, but they're putting them in a different role. A wage theft notice would have to be issued to that person. Or if the compensation is changing, you may want to issue a wage theft notice under those circumstances too. Okay, so that's the only little caveat. Now, if the employee was laid off and there was a complete break in service, then the employee must be rehired, and you're going to go through all of the new hire paperwork again. A couple of things to note though. Sick pay benefits must be reinstated to anybody, I think if it's less than a year, and they get rehired. So if you don't pay those out unless it's combined with PTO. So if you have sick pay and the person had, 32 hours of sick pay left so far this year, and when they were laid off, then you need to reinstate the 32 hours again. you can recertify prior Form I-9s. Now, keep in mind, I should have mentioned this yesterday, because we have a new I-9 form that was required as of May 1st, okay? If they were hired on an old I-9 form, then you recertify on the new I-9 form, okay? But it's Section 3, and if you need help with that, call me later. Also, check on your benefits, because waiting periods may be waived for like group healthcare programs, 401k programs, things like that. Under these circumstances, usually when somebody's let go or they leave for some reason and come back within a certain amount of time, the carriers are like, yep, you can put them on like next week, or the first of the next month or something like that. So they may not have to sit out like 60 or 90 days or wait for a period of time. So you want to do that. The other thing to know about new hire paperwork is like we're talking about bringing people back into the office, but if you're hiring people and they're working from home or working remotely, the the USCIS, who manages the Form I-9s, they came out with a new program that allows you to remotely inspect the documents for the time being until they're physically on site. So, up until now, the rule has always been that you have to physically inspect the new hire documents that are used by the employee to complete the I-9 form, or they're provided to you to complete page 2. And now they're saying, okay, that there's a way that you can remotely inspect those, and then there's certain steps you have to do and follow up on those things. So I just said about employee benefits, you want to make sure that you review all the benefits and figure out, hey, with the furlough or layoff or anything, were anything affected. Some other things to keep in mind is on group health insurance, telemedicine is now available. Now, some carriers have already been providing this. Now all the carriers should be providing this, right? Because at the federal level, everybody blessed it. So make sure that telemedicine is added as a benefit for your employees and encourage them to use that. On flexible spending accounts, over-the-counter medications are covered, so make sure that those are in your plans and your employee knows about it. And on the 401k plan, this is really significant. On the 401k plans and other retirement plans, they expanded, I think this was under the CARES Act. It might have been under the Secures Act, I can't remember, but they expanded rules for hardship withdrawals and loans. So it used to be on a hardship withdrawal, there was only specific conditions under which somebody could do a hardship withdrawal or loan, right? And they've expanded that because they don't want people losing their houses. They don't want people suffering financially. They also raised the level. So it used to be you can only take like 50% up to a certain dollar amount, and they've completely like taken those type of restrictions away or significantly changed them. So take a look at that too, to make sure that your providers are communicating with you about what the employees have access to, and let your employees know, because some of them, if they have not been working, might have some financial hardships, and this could help them. And then just again, ask if people can be reinstated right away. We've been getting a lot of questions about compensation. Some of our clients have made pay cuts or brought people back into different levels of pay. If you have had people working, maybe you cut their pay and allow them to work. Are you going to continue to have those pay cuts in effect? Are you going to revoke them? Think about all of those things. If you have people coming back to work, are you going to offer any hazard pay? That has been pretty common now, especially if people are working in warehouses or where they have maybe a higher level of exposure. So think about hazard pay and whether that'll be offered or whether it'll be revoked. If you think like, hey, we're all safe again, no worries. Just communicate with people, because where I see companies get in trouble is they make assumptions and they don't communicate with their employees. And the employee is like, well, what? I didn't know this was a temporary hazard pay situation. What are you talking about, right? So you want to make sure you're really clear with people about their compensation, because this is the one area you never want to screw with an employee. I'll just tell you, it's like the rule 101 in HR, like don't mess with people's paychecks, right? So just make sure that you're really clearly communicating with them. If you're on some sort of annual pay increase or review system, whether you're doing it tied to the employee's hire date or you're doing a focal point review, were some missed? What are you going to do about those? How are you going to handle those? Will bonus plans be affected, right? This may be more for-profit companies, but some of you may be offering bonus plans and they may be tied to productivity or tied to some standard. Well, what are you going to do about that? Will the employees not be able to achieve the bonus? Are you going to revise the bonus? So think about that. And then let's just talk real quickly about rules for changing compensation, because we get this question a lot, which is, can I change somebody's, hourly rate of pay? I want to bring them back, but I can't afford to pay them $20. I can only afford to pay them $15. What should I do? So I would say, A, think also back to the work share program, might be a way around that. But for non-exempt or hourly employees, the answer is yes, you can change their compensation in a non-discriminatory way, right? Not for all the whites, not for all the blacks, not for the women, stuff like that. But you can change their pay, but you cannot do it retroactively. So you would have to announce to somebody like, hey, Stacy, I can't afford to pay you what you're paying. I'm paying you starting Monday. And I will just say, starting the next payroll period, to make your life easy, starting the next payroll period, I'm going to have to reduce your pay to whatever, right? And then you're going to want to document that on a payroll status change form or something else. For exempt employees, the rules are a little bit different, because remember, if you're an exempt employee, you have a duties test to meet, and you also have a minimum salary requirement. Okay, you can reduce an exempt person's salary, but not below that threshold, which is twice minimum wage for whatever your size organization is. Okay, so if somebody's at like 55,000, you cannot drop them down to 30,000, something like that. So just be careful about that. One way around that is to change them to hourly, and you can do that. They can still manage people or something, but instead you pay them hourly with everything else. With they document their time in, out for lunch, back in. They get overtime if they work overtime. So you can do that, and you can do it temporarily. Again, just communicate with them and let them know. Okay, other policy changes that you're going to want to take a look at. So I referenced this before. So there's the federal OSHA standard, at that, the section that I mentioned before, 29 CFR. There's also a requirement in California that all organizations provide an injury and illness prevention program to their employees. And so this link that I have right here, if you don't have an IIPP already written, then go to this link, because it's an electronic wizard, and you just start it, you answer some questions, and then poof, it just like spits out a plan that you can use, which is great. You're going to want to think through how you need to adjust your IIPP for any of the safety things that we've been talking about. Okay, so if there's a section in the IIPP covering personal protective equipment, then you're going to want to make sure that you update that, or at least have an addendum, which is another way to do it for the time being. Okay. You also should think through whether or not you want to develop a written COVID-19 response plan. I don't know of anything that is requiring this. However, I will say some of our customers, some of our clients have been required to do it by some of their vendors or customers. Okay, so think about that, but you should think about this in terms of, again, all the things we talked about: the physical safety, the personal safety, everything like that. Some other policy changes that we should talk about are, paid leaves. Like automatically, you're going to have to adjust your paid leave policies to include the emergency paid sick leave and the EFMLA. Attendance policies, think through, does my attendance policy do what I want it to do? Like, we want to encourage people to come to work, but not if they're sick, right? So if you have an attendance policy that says, hey, if you miss so many days, I'm going to fire you, which you shouldn't have to begin with. But if you have something that's trending that way, you're going to encourage people to come to work sick, and you don't want to do that. Time off request procedures should be included. So if somebody's calling out sick with something unrelated to COVID-19, what's the process? If they're calling out sick with COVID-19 symptoms, is there a different process? If an employee gets sent home by the company, what is that process, right? Think about all of those things as well. If you're implementing flexible scheduling options, then what's your policy around that? Or travel policies, telecommuting, IT policies, anything like that that you're changing, make sure you're going to document those so everybody's aware of them. All right, we said before, over communicate, right? So I'm going to continue to say over communicate with everybody, including employees, clients, vendors, and the community at large, especially for nonprofits. You guys are, not just client facing, but community facing. Unlike my for-profit clients, some of them, they don't have to worry about that, right? But what steps are being taken to reopen safely? You want to let everybody know so they don't have a fear if they come on site. What new policies are in effect? Your employees definitely need to know that, but maybe some of your clients do as well, or your vendors or the general public. So that's the other one is, how are third parties going to be trained? What do they need to know? Like I said about my doggy daycare, they created a video to train everybody how to bring the dogs into the building. They have everything posted when you drive up. They have a whole new procedure in effect, and they did a really good job, in my opinion, notifying their clients, us, about what to do. You want to be prepared with communication materials already in the event someone tests positive, right? Hopefully it never happens, but you want to be really clear about the steps in that process of what to do when someone tests positive. So develop a policy on that, and also the communication materials that you're going to use. And then on the last bullet here, think about media relations. Some of you probably already have somebody designated in your organization to be in touch with the media or to respond to media requests. You're going to want to think that through. And if you don't have somebody, have a point of contact, get them some training if you need to on how to deal with the media. Especially think about, look at these meat plants, right? There's a Tyson food plant, I think, that had 56% of their employees test positive this past week. Like, oh my gosh, like that's mind blowing to me, right? You don't think that their media is all over them. So somebody needs some training on what to say, how to say it, all of that. So think through that as well. This is another good place for us to stop and answer questions, and also have Stacy talk about what OneOC is doing, Kevin.
Great. Well, let's do a few questions and then I'll pass it over to Stacy. One question came in. If you contemplate 1 or 2 pay period furloughs for all employees, and that furlough missed paycheck causes a currently exempt employee to fall below the minimum exempt compensation level for the year, what is the solution?
You are going to have to pay them their full salary. Yeah, I don't know any way around that. So it's a good question. I hadn't thought about people handling it that way. But yes, you cannot drop them below the minimum salary. So you're going to have to pay them. And I tell you what, like my brewery client did also, keep using them, but we've been through so much with them. We furloughed the hourly employees, and we had the locations run with just the 2 or 3, like the kitchen manager, the general manager, and the assistant general manager, who are all exempt. And then as we bring people back, they took pay cuts, but we made sure that they didn't dip below that minimum threshold. I think that, that's what you have to look at is, okay, do I need to change their roles and make them non-exempt if I'm going to be doing this in the future? But remember, if they work even 1 minute during the work week, they need to get their full salary.
Right.
So for exempt people, I would leave them employed as long as possible. Under work share, you're going to have the same issue. You can reduce it, but I don't believe that you can go below that salary threshold.
Got it. Great response. Yeah, and definitely if you do have to bring them back and you've already furloughed them, then yeah, going hourly is a potential solution.
It is, for sure.
And then, yeah, the last, a bunch of people have been asking, will this be recorded? It will be recorded and it will be sent out to everybody. So that's all the questions so far. So Stacy, go ahead and take it away from there.
Yeah, we'll talk to Stacy, and then we're going to go through those exposure scenarios.
Okay, thanks, Linda. So really quickly, just want to touch base on OneOC's plan that we put together, 6-point plan, mainly our safety committee and mainly me, because I'm the one that's in the office right now. But we are looking at 6 factors prior to bringing our employees back to work. One good thing about OneOC is most of our employees can work remotely. We do not have a lot of public coming into the office outside of one area where it's our court referral programs and we're practicing social distancing and when they open back up. But right now, we are preparing the facility, as I mentioned. And so we're just making sure that we're putting everything in order. We're securing our appropriate equipment, PPE. Right now we have cleaning stations already set up in our common areas and at our front desk. And so the cleaning stations we're providing, and we were able to luckily order these things ahead of time before they became scarce in getting them. But we have masks at the cleaning station, we have gloves, we have Lysol, and we have sanitizer as well as Clorox wipes. And so we have buckets basically in each one of our common areas and at the front desk. Our safety committee is responsible for cleaning those hard surfaces, those commonly used areas and surfaces as well. Probably going to move into some type of schedule with that. Right now, we're doing it pretty sporadically throughout the day. I say that if I walk in now and I don't smell Lysol or I don't smell bleach, then something is wrong. Like we no longer can smell perfume and cologne like we used to back in the day. So I need to smell Lysol and bleach sometime throughout the day, but we want to formalize that more. So we're preparing our facility. Next, we want to prepare the workplace. As much as possible, we want to increase predictability. This is an unpredictable time for sure. And anytime there's unpredictability, of course, there is fear, there is anxiety that's surrounding. So our goal is to increase predictability. We want to provide the necessary tools to managers as far as working from home and also being able to come back to work. For the most part, our number one priority, of course, is going to be the safety of our workforce. Of course, we still have to look at business continuity. We're looking at that as well, but the safety of the workforce is our top priority at this time. And again, want to minimize anxiety and want to minimize any stress as much as possible. Sorry about that. So predictability is number one. And so we want to prepare the workforce. We talked about communications. We cannot communicate enough. We're looking at trying to move a little bit out of the crisis mode, right? We want to transition from the crisis mode and definitely want to do so. We have to communicate more. And so we had increased our communication. We have one team that's meeting literally every day. They're having conversations in the morning, every day, whether it's Zoom meetings or calls or what have you. We also have a messaging task force type of team that meets every day as well, or that was meeting every day, and now we've lowered that. Again, kind of transitioning out of crisis mode more into information and returning to work. We still have a weekly team meeting with all of our staff. So we have a weekly call, just a half an hour, but it's a point of connection where we all get together via telephone, and we still try to add some normalcy. So we still celebrate birthdays on this call, still celebrate work anniversaries. We did so prior to the call. So we're still trying to add that little bit of normalcy, but we're communicating more regularly. The third factor is about controlling access. So as Linda said, what are we doing with our vendors? What is going to be our policy about the public coming in? I mean, we have clients that we do nonprofit accounting for. They come in and they pick up paychecks that they need, or we sign off grants and it has to be a wet signature. And so they come in and they pick up those grants. And so we're talking about how are we doing that? We're always going to practice social distancing. With our mail carrier, we put our mail little bucket underneath a mail slot, so they don't have to come in. They can just drop the mail through the slot, and then we're physically taking the mail, the outgoing mail, either to the mailbox at the corner or to the post office. So we're limiting even the mailman coming into the building. We do have no contact for FedEx or UPS, so they're just leaving the boxes basically outside the door, and then we're going to get that. But controlling access all the way around. As far as health checks are concerned, we're not taking temperatures. We've decided that we're not going to do that. And so we'll have the signage up around the office of kind of like when you go into the grocery store, right? If you have these symptoms, do not enter. But we're not taking, we decided that we weren't taking temperatures at this time. But outside of that, we're going to put the protocol in place for our visitors. And we're going to create the physical distance plan. Been very, very conscientious about not calling it social distance at this time, but more so physical distancing. So we want to create that cohesiveness, right? And just that togetherness and unity. And so we're saying physical distance, but we're putting that together. We do have a lot of common areas. We offer trainings. We offer in-person trainings. Right now, of course, we've shifted to virtually, but even through our court program, they're more than likely going to move back to in-person trainings. And so our training room, we're going to have to put that and set that up in a way that that we can practice that physical distancing, right? So the chairs, where we're marking the chairs or what have you, you can sit here and here, and I don't know, we're going to put X's or I don't know,
Yep.
but we will be practicing that physical distancing, as well as our own conference rooms and our training rooms, keeping as many doors open, like physical doors open, as possible, just to minimize the touch and reduce the touch, so we don't have to open the door, touch the doorknobs to open. So we are doing that as well. So just some things, little things even, that we're thinking of, and I'm saying little loosely, but just being very conscious, as Linda had said earlier, about things that we normally just haphazardly do. So we talked about increasing the cleaning. Our safety committee is working on that, minimizing the touch points, and then again, just communicating and over communicating and repeating ourselves, and
Over and over and over
and over again. And so that's our kind of 6-point plan that we're working on at this time, and pretty much in stage 1, but we'll be moving through that very quickly.
That's great, Stacey. I mean, you guys have thought through a lot of things, which is really helpful. And I hope that hearing what you guys are doing is inspiring some other people to think through some of those same things. But yeah, the communication aspects of this is so important. And I totally agree with you on item number 4. I've been calling it physical distancing since day one. I didn't ever understand the phrase social distancing. Like why would we want to do that, right?
Right.
Yeah, so physical distancing, though, is super important. Kevin, any other questions before we move on to some of these scenarios?
Yeah, we had one. 2 people had the same question, actually. Is there any information you can provide on employees that are currently on leave right now during this time? What if you're not expecting to have this employee back, since you're reducing some programs, there's some liability? So maybe you could talk about at-will employment. I'm not sure how that all ties in with that.
Yeah, I'm not sure I totally understand the question, but I'll take a stab at it, and then whoever asked it can ask it again if I didn't get it. And at the end, we can also, unmute people, and you can just ask directly if you want. Right now is probably the safest time ever to let people go. I mean, I was talking to another client yesterday. They furloughed people, and now they just realize that they're starting to lose clients. They just think, it's going to be a long time before they can bring people back. And so they're making the decision to go ahead and formally lay people off. And that's fine. I mean, it's not going to be unexpected, probably by a lot of people. As long as you don't have a contract in writing with them that says otherwise, as long as, again, you're doing it on a non-discriminatory basis,
Right.
you're complying with all of the rest of the normal rules around terminations in terms of making sure they get their final paycheck and accrued vacation paid out and things like that. Right now is probably like an easy free swing, to be honest with you, when it comes to letting people go.
So they both just chatted, and they said that current employee is on medical long-term leave.
Oh, okay. That's a different
That
situation.
changes things, I think. Yeah.
Sorry. I was thinking you
Thanks
meant
for
they were
context,
just on
guys.
yeah, I thought you were talking about they were on like a furlough situation. Yeah. So same rules apply if they're on a medical leave as normally be on a medical leave. You can't let them go because of that. Now, having said that, I've had to lay off like pregnant women before in my career, right? If this person that's on a medical leave, let's use pregnancy as an example. Let's say there's a woman that's on pregnancy disability leave right now. If she would be laid off anyway, like had she been working, then you can still do it, right? So it's not without risk, but so it's not like a free swing, like I said a second ago about just, COVID related stuff. But if you can demonstrate, like you're going to shut down an entire department, for example, something like that, then, and she was part of that department, then you could go ahead and do that. I would very much encourage you to seek either guidance from an HR consultant or an employment attorney or somebody that can help you with this and look at the specifics of that situation before you let anybody go. Because if somebody's on FMLA, if somebody's on pregnancy disability leave, they have job protection. Again, there are some exceptions to that, but they're few and far between. So for example, if you have 10 people working in your programs department and you're going to cut it in half and you decide, oh, I'm going to do it based on tenure, but one of those people is pregnant, I'm like, ooh, I'd be really careful, right? I'm not saying don't do it. I'm just saying I'd be really careful, and I would seek some guidance first before you do that.
Great. That's really helpful. Thank you, Linda. She added one more point, and then we can move on to a different question.
Okay.
But if that person or that individual is outside of their protected leave, does that potentially make things easier in terms of?
Absolutely. That's what I'm saying. The specifics to those type of scenarios are so important, right? To take a look at the big picture and understand, you know, what's their length of employment like. If you've just been giving them additional time off and they're no longer job protected, that's different than if they're job protected. So absolutely, you're going to want to seek some guidance on and making sure you're doing it the right way. Yeah.
Great.
Okay, let's take a look at some scenarios that we put together, and then we'll open up to questions. These are the last few slides. So the first one is what to do if an employee has symptoms. So whether they're, you know, if they're at home and they develop symptoms, tell them to stay home. If they're at work and they develop symptoms, tell them to go home, right? So you want to take them out of keep them out of the work environment as long as possible, and they should seek medical advice, right? They may be able to get tested if they're advised by their doctor. The other thing that Governor Newsom mentioned yesterday is on that California, the COVID-19.ca.gov website. You can go there now, and there's actually a partnership they developed with a third-party company that you can put in your zip code and it will tell you where you can go to get tested. I don't know if anyone can just go get tested or if you have to have symptoms or be referred by a doctor, but that is up on the website. I just couldn't find a lot of the rules around that, but they should get tested, advised by their doctor. Remember that they may qualify for EPSL under either number 2 or number 3 there on that list if they're seeking medical treatment or if they've been advised to stay home. The rules, remember, don't return to work until there's no fever without meds for 3 days, the respiratory symptoms have improved for 3 days, and 10 days have passed since the symptoms began. So that's the most important thing there. All right, scenario number 2 is if a worker is exposed outside of work to someone who tests positive. So we've gotten this call a lot. We have an employee who lives with his parents and both parents tested positive. He's been asymptomatic, right? And then he became symptomatic. And so it's like all of these things you have to sort of navigate. So if an employee is exposed outside of work to someone who tests positive, first and foremost, remember what the definition of exposure is. And I'm going to pull that up and read it to you because the CDC has a very specific definition. And it says potential exposure means being a household contact or having close contact within 6 feet of someone with confirmed or suspected COVID-19. And the time frame for having contact with that individual includes the period of 48 hours before the person became symptomatic. Now, let me tell you why that's important, because we get a lot of these calls where it's, you know, I was with my boyfriend this weekend and he had another employee at his work tested positive. Do I need to go home for 14 days? Or the example I told you, both my mother and father tested positive and I live with them, right? Can I come to work? Like all of those different types of scenarios are coming up. Early on we had, you know, it's always like the step removed, right? So the definition of an exposure is really critical here because you want to make sure that you are, again, you can be more conservative than this, but I'm just saying a lot of times it's fear around that. An employee hears about another employee who knows someone that tested positive and they don't want that coworker coming to work. It doesn't work that way, right? If the employee is asymptomatic, the CDC says they can continue to work, but they should use a mask for the next 14 days, okay? You can choose to have the employee self-quarantine for 14 days. You don't have to legally pay them. They can apply for unemployment and see how it goes. If the employee becomes symptomatic, then you're going to want to keep them home or send them home and follow the instructions on the prior slide. Okay, but just because there was an exposure doesn't mean they can't work. It just means that extra precautions need to be taken. All right, our third scenario is if a worker is scared and doesn't want to come to work. So Kevin had asked this question on someone's behalf earlier. My first question I would say is this a legitimate concern or is it a generalized fear, right? There are many employees that they say, I don't feel comfortable going back into the workplace. Some have said, I don't feel comfortable because I live with my mom who's over 65 and I don't want her to get sick, or my mom's got, you know, COPD or some other respiratory illness and I don't want to make it worse. So this is where, again, I say be flexible. It's an employee can't just refuse to come to work because they're scared. it's like that may, again, jeopardize their employment benefits, unemployment benefits. You could essentially say, okay, then would you like to quit your position? Like you could do that. You could also have some compassion to the extent you can do that and say, okay, do you want to take a leave of absence? Right? Do you want to do something else? Is there a possibility they could continue to work from home? You're going to have to get in the business of taking everything on a case-by-case basis. A lot of times my clients like, well, if I do that for one person, do I have to do it for everybody? Do it for everybody similarly situated. But if I live with my mom who's 80 and she's got a pulmonary disease, that's different than just you're scared, right? Or that you live with a roommate who's in their 30s. So you can be very specific about what similarly situated means, okay? So the first thing I would do with the employee is sit them down and say, okay, what is your specific concern? And if they just stay at a very high generalized, I'm afraid, then a little education goes a long way. Maybe sit down with them or talk with them and virtually sit with them and go over like what exposure means, or, talk about what the steps they can take to protect themselves, right? You can do that. If they have a really specific concern, then address it. If they go, well, I'm concerned because this person tested positive, or this person's been coughing, or I don't have the right PPE or whatever, then help them fix that situation, right? Remember also, if they're scared and they fall into a high risk category, then they may have protection under the ADA or the American with Disabilities Act, and they may be eligible for EPSL as well. So again, this one's a little tricky because it's on a case-by-case basis, but they don't just have the right to not come to work because they're scared, okay? And then our fourth scenario, finally wrapping up, is if an employee tests positive. If an employee tests positive, obviously send them home or keep them home, whatever the scenario is. You're going to need to ask that employee to identify all employees with whom they came into close contact with in the past 14 days, okay? So this isn't a situation where you go out to the workforce and say, hey, Sam tested positive. We absolutely do not do that, okay? Again, there's some really strict confidentiality issues here and privacy issues, but you're gonna go to the employee that tests positive, help them, support them in any way you need to. Ask them to identify, like, who at work did you come in contact with, close contact, remember the definition, over the past 14 days. And then what you're going to do is you're going to notify those employees, and this is where you should create this ahead of time, notify the employees of the possible exposure, but you cannot identify the employee tested positive. Now again, realistically speaking, if you have 5 people working in an office, one's out sick, and then you tell the other 4 that they were exposed, everyone's going to put it together. So be it, but you cannot like put out a memo that says Sam tested positive. You cannot do anything like that. So I want to be really clear about that. You're going to want to thoroughly clean and disinfect the work areas. And again, there's CDC guidance specific to if somebody tests positive. Advise the current employees to seek medical advice, as well as obviously the other person as well. You could, if let's say that you have a workforce of 25 people, the employee that tests positive said, I work closely with these 5. Okay, you could send those 5 home, right? Have them work from home and see how it goes. If the employees, they can continue, right, to work, but again, then I would have them wear masks for 14 days, right? Just to make sure that they remain asymptomatic. And if they ever develop symptoms, then you're back to the other scenario, seek medical attention, stay home, all those different things, okay? And I think that is it, Kevin. So tell us if there's any other questions we need to address right now.
Great. Well, Linda and Stacy, thank you so much. I just want to say thank you before we jump into that, for taking so much time. This has been such valuable information. And
Good.
like we've said, this is going to be recorded. So we covered a lot today, like a
Yeah.
very wide breadth. And so I'll be sending this recording and these slides if you need to go through, and I can include Linda and Stacy's info should you have additional follow-up questions. But I'll go ahead and give you, there's not any in the chat, but if you have any lingering final questions, go ahead and give you 1 minute to go ahead and type those in. We are coming to the top of 90 minutes. So go ahead and put that in right now if you have any questions.
Yeah, and remember that we do have these other slides on here that I just added to the back. So if you download the slides, it has a little bit more information about, EFMLA and all of those different things as well. So if you have any, questions, and again, he'll give us our information. So feel free to reach out if we can answer anything specifically.
Awesome. Looks like we have a lot of thank yous, but
good.
Final
You're
question.
Welcome.
Very helpful information, everyone's saying.
Good.
If an employer decides that a particular did we already address that? Oh yeah, if an employer decides that a particular position is no longer needed and eliminates that position, is it okay to do it during this time if the employee is eligible for unemployment? We kind of talked about that.
Absolutely. Yeah. Again, if there's a secondary issue going on, like the person's pregnant or something like that, then tread lightly. But generally speaking, if you furloughed everybody and now, like I've got this going on, I think I mentioned with one client, they furloughed everybody. Now they realize, you know what, it's going to be a while before we need them. They're sending them, I said, why don't you pick up the phone and call each person, follow it up with an email, treat them with as much respect and dignity as possible. They're going to have stuff at the office. You're going to have to figure out how to deal with that. You know, do you box it up and send it to them, make it available, have them come in, all of those typical things. But just treat them with respect and dignity and just say, we're really sorry, but we've lost clients. We don't, for this is happening. We want you to feel comfortable going out and applying for other work. And if in the future, you know, we're in a position to rehire you, then at that point we can reach out and we'll see where you are in your career, right? If that makes sense. But no reason to continue to have them believe they're under furlough, which would imply they're coming back soon if you know things have changed and that's not going to happen.
Right. Very helpful. All right. Well, I think that's the end of our questions. Again, thanks so much, Linda, and thanks so much, Stacy, for taking the time. And yeah, very helpful resources.
My pleasure.
Helpful, so.
Thank
All
you.
right. Thank you so much.
All right. Take care, guys.
Bye.